begin.
Hello everyone, and welcome back to my show. I'm Dr. Lott from Acupuncture is My Life. Now in this final episode of Acupuncture, the coronavirus and hypertension, I'd like to discuss 3 interesting questions posed to me before going into acupuncture treatment and protocol pertaining to hypertensive patients. Now the first was, is it safe for your child who has pulmonary hypertension to go back to school and for you to go back to work? Now I will say this, if your child has pulmonary hypertension, it's best your child avoid crowds or groups larger than, let's say, 8 or 9 people. A child who presents with some of the symptoms of COVID-19, let's say such as shortness of breath, fever, sore throat, cough, they should not attend school under any circumstance. Now, most schools by now have created options whereby children can partake in distance learning of some sort or other remote options. Now, this is something I'd recommend parents discuss with their child's school administrator. Now, as for parents, I'd advise working remotely whenever possible. Now, the next question was, are you at risk of becoming infected with COVID-19 if you ate at a food court in a mall when the malls reopen, which some have? Now, from my understanding, there's no evidence to support the theory that this virus can be transmitted through food. Now, you can become infected from those that are patronizing the mall and are infected themselves, and you're in close proximity of them. Now, please understand, everyone, this virus is highly transmissible, so please take extra precaution in protecting yourselves. And the last question I decided to respond to was, as a pulmonary hypertensive patient, how can you tell if your breathing issues are related to pulmonary hypertension or the coronavirus? Now, this was a tough one. This is tough because some of the symptoms of COVID-19 are similar to those of an individual with pulmonary hypertension. So I think I'm going to shy away from answering that and simply suggest that you speak with your primary care physician, or if it's your child who has pulmonary hypertension, speak with their pediatrician about that. Now let's dive back into discussing how an acupuncturist would treat the basic patterns of hypertension from a Chinese medicine perspective. Remember, from my last episode where I stated there were 5 basic patterns related to hypertension in Chinese medicine. And the first one I discussed was liver fire excess. Now, whereas in this case, a patient would present with headache, dizziness, tinnitus, irritability, red eyes, and dark and scanty urination with constipation. This individual would have a dry tongue with a yellow coating and a rapid and wiry pulse. Now in this situation, I would look to purge the liver fire, pacify the liver, and I would look to suppress the yang, just a little bit. Now the next pattern could be yin deficiency with hyperactive yang. Now in this case, a patient would present with a heavy sensation in the head and as if their lower extremities were weak, whereby they would not like standing or walking much. There would also be dizziness as well as headache. The patient could also experience palpitations with tinnitus and insomnia. They would have a red tongue with a thready pulse. Now my approach in this case would be to nourish the yin and suppress the yang. The next pattern could be liver and kidney yin deficiency, whereby the patient would present with dry eyes, dizziness, soreness of the lower back and knees, night sweating with numbness of the limbs, and dream-disturbed sleep. Another pattern could be both yin and yang deficiency, whereby the patient would present with an empty sensation in the head, along with headache and dizziness, shortness of breath, edema of the lower extremities, palpitations, amenorrhea, and seminal emission. The patient would also have a red tongue with a thin coating and a weak pulse. My approach to this pattern would be to replenish the yin and assist the yang. Now, the fifth potential pattern would be damp turbidity obstruction, whereby the patient would present with a headache, dizziness, and a clouded sensation in the head, along with a stuffy sensation in the ears as well. There's potential for palpitations with a stifling sensation in the chest, and a poor appetite, and a feeling of nausea. The patient in this case would display a pale tongue with a thick, greasy coating and a slippery pulse. In this situation, I would look to dry the dampness, extinguish the wind, and transform phlegm. Now, of these basic patterns, there are some common acupuncture points I would use. Let's say such as GB20, GB34, DO20 at the top of the head, spleen 6, LI4, and LI11, along with stomach 36. This is the basic approach in which an acupuncturist can take in diagnosing and treating hypertensive patients to better assist them in managing hypertension, especially faced with the potential of being infected with COVID-19. Now, don't forget to subscribe to my show. And until next time, acupuncture is my life. What's yours?